Hello everyone, let's see Dean's alveoloplasty in short. So what is basically alveoloplasty? It is excision of irregularities, spicules or unfavorable undercuts on the ridges which are unsuitable for the denture. So goals of alveoloplasty are to get an optimal ridge contour quickly. The alveolar ridge should be as broad as possible for maximum distribution of masticatory loads. The sharp edges are to be rounded and the irregularities are to be removed. The mucosa which is covering the ridges should be smooth and of uniform thickness. There are two types of alveoloplasty. One is primary, that is, the alveoloplasty is done at the time of extraction. An example of this is Dean's interseptal alveoloplasty. And the secondary type is in which the bone correction surgery is done on the edentulous ridge after the initiation of the extraction socket healing. Dean's alveoloplasty. The indications for this are it is only done in anterior maxilla immediately after the extraction of anterior maxillary teeth when large buccal undercuts are present and they are not allowing the prosthesis, and in proclined maxilla, that is class 2 in edentulous patient where the prosthesis is needed. So the technique in this, local anesthesia is given, that is bilateral infraorbital nerve block and nasopalatine nerve block. Then extraction of the maxillary anterior teeth is done. After this, the removal of interradicular bone, this is the socket, and in between the socket, the interradicular bone is removed. It can be done using hand instruments, that is chisel and mallet, or by a micromotor. And the sockets will merge with each other. So after the removal of interradicular bone, the sockets, these will merge with each other. After this, we will prepare vertical stops. These are the vertical stops will be prepared how? Through the labial cortical plate in the canine area with the chisel and mallet or with micromotor. Then inward fracture of labial cortical plate is done towards the palate. What will happen with this? First of all, protrusion will reduce, the socket will become compressed, buccal undercuts will be removed and overjet will decrease. And finally, suturing is done. The advantages of this is no flap is needed and no as no flap is needed, no post-operative bone resorption will happen. And along with extraction, maxillary proclination is removed. So no extra surgery is required. Of Wisger's modification of Dean's alveoloplasty. In this, the same procedure is done, but instead of one vertical stop on the labial aspect, two vertical stops are given, one on labial and one on palatal aspect. And then inward fracture of both the aspects is done, that is buccal and palatal cortical plate, this is done in cases where is high proclination. So this was all. Thank you for watching. Like and subscribe if you found this helpful. Thank you.